Awesome. Good afternoon, ladies and gentlemen. Welcome to our 2021 Go Red for Women breakout session presented by Providence Alaska Medical Center. My name is Kristen George, and I'm the Senior Development Director at the American Heart Association. We want to welcome you today to our first ever digital Go Red for Women breakout session presented by Providence Alaska Medical Center. This year, in adjusting to all of the changes in the world, the American Heart Association had to pivot and reimagine our beloved Go Red. We hope that you were all able to join us and enjoy Go Red on February 10th with our keynote speaker, Catherine Childers. Before we get started, we do ask that you remain on mute today because we do want to enjoy our guest speaker, but we do want you to interact with us still. So please open those chat boxes and make sure to ask your questions at any time. Born and raised Alaska, Lisa Lindquist Md is a board-certified psychiatrist and addiction medical physician and is the chair of psychiatry at Providence Alaska Medical Center. She also serves as medical director of the Consulate Liaison Psychiatry Service, the electroconvulsive therapy service. I knew I was going to get one word wrong, and medication assisted treatment bridge clinic. While at Providence, she has been involved in the development of the opioid use disorder clinical pathway, which has been adopted by Providence St. Joseph Health System and is being implemented system-wide. As a member of the Pain Management Clinic Council and the Substance Misuse and Prevention Council, Dr. Lindquist has been involved in the development of clinical practice guidelines for addiction, as well as nursing and physician education. Dr. Lindquist is currently involved in the expansion of interventional psychiatry at Providence Alaska Medical Center to include electroconvulsive therapy, ketamine-assisted psychotherapy, and broxolone, a new treatment for postpartum depression. And Dr. Lindquist, please tell them that I said that wrong. Prior to joining Providence, Dr. Lindquist served as a chief resident for the general psychiatry residency at University of North Carolina Hospital, while she completed her psychiatry residency and received additional training in psychometrics medicine, perinatal and addiction psychiatry. While at UNC, she received the UNC Department of Psychiatry Resident Teaching Award and the Rita Burstein Wessler Award for residency research for her research on military traumatic brain injury. Dr. Lindquist is a diplomat of the American Board of Psychiatry and Neurology and the American Board of Preventative Medicine. She is a member of the American Academy of Consultation Liaison Psychiatry, the American of Psychiatric Association, the International Society of ECT and Neuromodulation, and Marseille of North America. That was a lot of big words, folks. She now lives in Eagle River with her beautiful family. Today, Dr. Lindquist will be speaking to us about whole person care, the connection between mental and physical health. Dr. Lindquist, welcome.
Thank you for having me. I appreciate it. All right, let you get those slides going. All right, can everyone hear me okay? Yeah. All right, we'll get started. So today I want to talk about a typical scenario in medicine. We have a 55-year-old woman. She has diabetes. We'll call her Sarah. She frequently misses her appointments. She has significant trouble managing her illness. Her blood sugars aren't well controlled, and she is experiencing multiple complications as a result of her illness, to include neuropathy or nerve damage, resulting in repeated foot wounds due to poor sensation in her feet. She also has retinopathy or disease of her eyes as a result of chronically elevated blood sugars. She is frequently admitted to the hospital with blood sugars that are so high that her electrolytes and acid-base balance are altered, and she is confused. Recently, she had a heart attack. These are challenging encounters, and in our medical field, wherein physicians are lucky to have 15 minutes to check in with their patients, maybe as infrequently as every 3 months, you can imagine how it might be difficult. But what are we missing with Sarah? Dr. William Osler, one of the 4 founding physicians at Johns Hopkins Hospital, wrote a book, The Principles and Practice of Medicine, which was a landmark textbook of internal medicine. And in it, he wrote, it is much more important to know what sort of patient has a disease than what sort of disease a patient has. In the case of Sarah, there's so much more to her than her diabetes, retinopathy, neuropathy, and heart disease. Sarah's a mom. She has 2 teenage kids who've been home for the past year because of a COVID pandemic. And Sarah's been trying to help them with their high school level courses. Because of her eye disease, she's disabled. She's unable to work out of the home or even drive safely. So she relies on the bus for transportation, which means when it runs late, Sarah misses her doctor's appointments. She relies on a fixed income from her disability, and frequently finding affordable yet healthy foods is really difficult for her. Her 2 boys like to play sports, and there have been times when she's been forced to decide whether or not she pays for her utilities, her medications, or her son's athletic gear, because she can't afford all 3 in a single month. Sometimes her selflessness results in self-neglect. And for the past 6 months, Sarah's been struggling to sleep. Her appetite has been poor. She feels exhausted much of the time. She vacillates between being irritable and sad, but she tries to hide her tears from her sons. She no longer enjoys reading anymore, something she used to relish, and Sarah's depressed. There are millions of other situations and circumstances like Sarah's, each with different factors like cancer, homelessness, schizophrenia, anxiety. The list goes on and on. But in all of them, none of them are as simple as their physical illness. The reality is each of us is more important than just our physical health. We have within us the need for social, emotional, spiritual, intellectual, physical, financial, and emotional well-being and stability. And disruption in any of these can interfere with any of the others. Healthcare delivery systems and healthcare policy need to recognize and address or take into consideration each of these issues, as they all have the potential to impact one's access to healthcare and health outcomes. Moreover, addressing the factors that impact the whole person result in more efficient and effective use of our resources. But today, we're going to focus primarily on the interplay between these 2 components of our health, mental health and physical health. The relationship between our mind and our body is much more interlinked than we could have ever imagined, linked by hormones, immune factors, and even bacterial messaging. Further, our brain and body are bidirectional, and they're constantly in communication and adapting to one another. The things that impact our body can impact our brain. The things that impact our brain impact our body. And similarly, things that affect our mental health affect our physical health, and vice versa. For example, people with depression also report 3 times as many chronic physical conditions as those in the general population. And people with chronic physical conditions have twice the likelihood of experiencing a mood or anxiety disorder compared to those without chronic physical conditions. The state of our mental health significantly impacts the way we act, process emotions, and make decisions, to include decisions about our physical health. Research has been conducted regarding relationships between specific mental illnesses and their relationships with physical illnesses. I'm going to provide you details on a few of these, but know that there are many, many more relationships that we don't have time to talk about today. Let's start with depression. An incredibly important illness when you consider that it impacts more than 300 million people worldwide and is the leading cause of disability in the world. Depression has been linked as a risk factor for cardiovascular disease, cancer, low bone density or osteoporosis, diabetes, and arthritis. For women in particular, those with depression are 80% more likely to experience heart disease. Depressed patients are 4.5 times more likely than others to suffer a heart attack, and one study demonstrated that depressed patients face more than 3 times the risk of death following a heart attack. When we look at cancer, research was done into those that were ages 71 and older, and it looked at those who were chronically depressed for at least 6 years. And those that had an 88% greater risk of developing cancer in the next 4 years compared to those that did not experience depression. In schizophrenia, a form of severe and persistent mental illness, life expectancy is reduced by 15 to 25 years. And the majority of these deaths are from cardiovascular disease, not suicide. This is likely a result of increased risk of diabetes, high blood pressure, and high cholesterol. All of those are 2 times greater than in the general population. Additionally, people with schizophrenia have 3.5 times the risk of obesity. But interestingly, only about 12% of people with schizophrenia receive medication to treat their high cholesterol, and only about 40% ever receive treatment for their high blood pressure. Those with diabetes, 30% receive no treatment at all for their diabetes. When we think about women with schizophrenia in particular, they have a higher risk of breast cancer compared to those without schizophrenia. I think it's important to consider that there is one important factor in schizophrenia that is often not talked about, which is cigarette smoking. In the US population, only about 15% of adults smoke cigarettes. However, when we look at individuals with schizophrenia, nearly 80% smoke cigarettes regularly. In part, this is believed to be because nicotine may help control some of the symptoms of schizophrenia in patients. All right, switching to a more medical disease model, we think about diabetes. So people with diabetes have 2 times the rate of mental illness compared to those without diabetes. And yet only 1/3 of those with diabetes and mental illness ever receive treatment for their mental illness. For example, up to 40% of people with diabetes have anxiety. And we also know that rates of depression are twice that of the general population. Yet different studies have looked at those individuals with diabetes and anxiety or depression, and anywhere from 25 to 50% are receiving treatment, while upwards of 75% are not. When we think about type 1 diabetes, those individuals are twice as likely to have disordered eating, like bulimia, resulting in poor glycemic control, higher rates of hospitalization, and poor disease outcomes, like retinopathy or eye disease, neuropathy or nerve disease, and premature death. All right, I can't get away with not talking about the heart since we're all here because of the American Heart Association. The relationship between mental illness and cardiovascular disease is an interesting one. It perfectly demonstrates the bidirectional nature of the mind-body connection when it comes to illness and pathology. As I said before, those with severe persistent mental illness, the life expectancy is shortened by 20 to 25 years, and the most common cause of death is actually cardiovascular disease. When we compare this population to the general population, there's a 50% increased risk of coronary heart disease in particular, meaning the blood vessels that supply blood to the heart. And this effect is seen worldwide, not just here in the United States. The relationship between heart disease and mental illness is even stronger in women, military veterans, and racial and ethnic minorities. When we think about depression in particular, of those who have known coronary heart disease, the prevalence of depression is significantly higher, more than 4 times. And more than 20% of those with coronary heart disease meet criteria for major depressive disorder, while nearly 1/3 have some sort of symptom of depression. Unfortunately, those with coronary heart disease who experience depression have poor outcomes related to their disease. These connections between heart disease and depression exist even when you take into account smoking, physical activity, high blood pressure, and obesity. The link between depression and heart disease remains. As a result of this connection in 2014, the American Heart Association recommended that depression had to be considered an independent risk factor for poor prognosis after an acute coronary syndrome, like a heart attack. This recommendation was historic in that it was the first time a psychological barrier was officially recognized by a major health organization as a risk factor for a vascular outcome. We also see strong relationships between post-traumatic stress disorder, or PTSD, and heart disease. Both cardiac disease-induced PTSD and pre-existing PTSD in those who experience heart disease have been observed. Up to 15% of those with cardiac disease experience resultant PTSD, and this number increases to 25% after experiencing a heart attack. And unfortunately, developing PTSD after a heart attack doubles one's risk of heart disease, of recurrent heart attack or dying within 1 to 3 years. Additionally, PTSD is independently associated with double the risk of developing coronary heart disease. So what explains all the connections between mental illness and physical illness? Why is it like this? Science has explored a number of mediator variables that connect mental illness and physical illness. For the most part, these are variables external to the person, though you will see some biological factors on the bottom right as well, which we'll discuss in a few minutes. Both mental illness and physical illness can impact your social capital, your lifestyle, and your socioeconomic status. Both increase your stress, limit your cognitive skills, and impair your decision-making and information processing. By impacting these intermediate variables, physical illness can result in mental illness, and mental illness can cause physical illness. These indirect effects explain 8% of the effect of past physical health on mental health and 10% of the effect of past mental health on physical health. These indirect effects are actually stronger in males and those in older age groups. Not only are they a number of external mediators that you see here that connect our mental and physical health, but there are also several internal or biological mediators that connect these complex processes and states of the brain with our body, and vice versa. It turns out that hormones, bacteria, and our immune system interface considerably with our brain. All right, in this graphic, it's a pretty complicated relationship you can see between our brain, our endocrine or hormone system and adrenal gland, and our immune system and our gut. It isn't quite as simple as this graphic depicts, so I'm going to talk about some of the more salient features of each of these systems and how they interplay. All right, first we're going to talk about the neuroendocrine system, which is also called the flight or fight system. When functioning normally, our brain closely monitors our surroundings and environment to regulate this system. It's also called the HPA, or hypothalamic pituitary adrenal gland axis, because it connects the hypothalamus, the pituitary gland, and the adrenal gland together. When our brain discovers something stressful or scary in our environment, the system cascades to ultimately release cortisol, epinephrine, and norepinephrine from our adrenal glands in order to help us fight or flight to survive that stressor. This results in an increased heart rate, cardiac output, blood pressure, ultimately to supply our skeletal muscles with more blood in case we need to do something exerting, like run for our lives. And at the same time, cortisol also helps put a temporary pause on the things that aren't important at that time, like digest food or reproduce. Unfortunately, some of us live under chronic stress, which may lead to a hyperactive or overactive HPA axis at inappropriate times, and an underactive system. At times we might actually need a boost in cortisol, adrenaline, and noradrenaline, which may lead to a suppressed immune system, chronic fatigue, insomnia, insulin resistance, and diabetes. Chronic exposure to cortisol in the brain and the body can result in atrophy of the hippocampus, which is an area of the brain responsible for memory, meaning that it can result in memory impairment and poor cognition. Disruption of this axis is likely one of the mechanisms for the link between mental disorders and heart disease. We know that elevated cortisol results in the development of cholesterol plaques in the arteries and high blood pressure. Both of these are significant risk factors for the development of heart disease. Elevated catecholamines, noradrenaline, and adrenaline increase blood pressure and heart rate and place increased strain on the heart over time. The HPA axis is closely linked to our immune system as well and can be activated by some immune or inflammatory molecules. So it turns out that our immune system not only responds to foreign pathogens like bacteria and viruses, but it also responds to psychological stress. This graphic shows alterations that occur in a person with PTSD. Essentially, stress releases pro-inflammatory molecules called cytokines. You can see them there marked as IL-1, IL-6, TNF-alpha. Both high cortisol, or in the case of chronic stress and cortisol resistance, inflammation can happen as a result of aberrant cytokine release. So these cytokines in the body then access the brain via the vagus nerve or through active transport to the brain. And once there, they signal pathways that are involved in the altered metabolism of serotonin and dopamine, which are neurochemicals that are involved in our mood. So ultimately, alterations in these neurochemicals can result in depression. These inflammatory markers that are elevated, IL-6, IL-1, C-reactive protein, have all been demonstrated in people with depression and schizophrenia. Depression can also suppress the immune response to viruses and bacteria. So on one hand, you have a pro-inflammatory state, and on the other hand, you have an immune deficient state, meaning that those who have depression are going to be more susceptible to infection. Interestingly, when we treat depression with antidepressants, this normalizes the pro-inflammatory state seen in depression. Inflammation is thought to be another factor in the development of heart disease in people with mental illness in particular. Inflammation contributes to the development and progression of cholesterol-filled plaques in the arteries. All right, we can't talk about our immune system without the same time talking about all the bacteria in your body. In fact, more than 90% of the cells that even exist within our body aren't ours, they're bacteria. And most of them live in our gastrointestinal system and are working with our body in a symbiotic relationship. We call this the gut microbiome. Our nervous system within our gut, our enteric nervous system, then communicates with our brain and with the bacteria in our GI tract. We call this complicated relationship the gut-brain axis. And it isn't simply to keep the healthy bacteria in our gut in check, but actually these complex interactions impact our brain as well. The gut-brain axis involves the neuroendocrine mediators that I just spoke about. There are three pathways that produce this bidirectional flow of information between the brain and the gut. The first is the immune pathway, wherein the microbiome and the bacteria then interact with cells of our immune system to release various inflammatory molecules. The second is that neuroendocrine pathway, or that HPA axis. In this, the gut microbiota actually impacts that axis and the central nervous system or the brain by releasing neurotransmitters like cortisol, tryptophan, and serotonin in varying amounts. The third is the vagus nerve. The vagus nerve is the longest of our 12 cranial nerves, traveling from your brain all the way to your intestine. This nerve has neurons that transmit information from the gut to the brain and from the brain to the gut. It's responsible for regulating gut motility and gastric hormone secretion. Diet is also a strong determinant of our gut microbiome composition and diversity. There's a relationship between the health of this microbiome and our fitness, stress, sleep, and other behaviors that we might engage in. You can see that slide there sort of shows the cyclical relationship between our gut and our brain. But we also know that disease states can happen within this pathway. The population of microbes that's involved in various mental illnesses, including depression, postpartum depression, autism spectrum disorder, and functional gastric disorders like irritable bowel syndrome. And there's emerging research that looks at alterations in this microbiome that exist in Alzheimer's disease, Parkinson's disease, and schizophrenia. Interestingly, illness in the brain can alter the population of the microbes in the gut. So it's not just that the gut bacteria causes the disease, but the disease might actually change our gut as well. With anxiety, depression, and stress, cortisol and other hormones are released, which activate various hormonal pathways and change our gut motility, intestinal permeability, and mucus secretion. This prompts a change in the composition of the gut microbacteria and results in what we call dysbiosis, meaning that the composition and the makeup of the bacteria in our gut isn't what it should be. This ultimately results in the release of endotoxins within the blood. Immune cells then detect this change and inflammation results, ultimately making its way to the brain and worsening that depression and anxiety cycle. Scientists have actually studied the poop of people with and without depression to compare the composition of each. There's different bacteria that are constantly associated with better moods and higher quality of life indicators, whereas some bacteria like Dialister and Coprococcus are very low in depressed people. The question, of course, is, might there be a role for changing the gut microbiome to treat mental illness? Some bacteria, like certain species of lactobacillus and bifidobacteria, have been found to reduce cortisol levels, that stress hormone we talked about. So there's ongoing research to determine if they might be possible treatments for depression, because they've been found to lower negative thoughts, improve cognition, and may actually reduce symptoms of irritable bowel syndrome. The collective name for these potential microbiota treatments is called psychobiotics. It's possible that very specific strains of bacteria may prove beneficial in reducing the symptoms of mood disorders. Similarly, prebiotics like fructans and oligosaccharides may influence and support good bacteria within our gut. The science isn't quite ready for prime time, so I can't recommend that you run to your store and buy a specific brand of probiotic to support your mood, but I anticipate that within the next decade or so, we'll be seeing psychobiotics available and being used to treat and support people with mental illness. All right, so taking this all into consideration so far, you can understand why it's important that when I care for a patient, where I'm mindful about their physical health, their mental health, and their social and community resources, or in short, why it's important that I provide someone with whole person care. There's been a lot of studies about this and its efficacy, and it turns out there's a number of positive outcomes associated with whole person care. For example, there's a 30% reduction in hospital readmission rates. Patients are going to be more engaged in their care, and the cost of care overall has decreased. Additionally, there's a 74% reduction in symptoms of major depressive disorder. And of those individuals with substance use disorders like alcohol use disorder, opioid use disorder who attend treatment is 148% more successful when whole person care is provided to them. But I wouldn't be a good psychiatrist if I didn't at least spend a few minutes at the end of our talk today chatting with you about how you, as people in community and patients, can address the relationship between mental and physical well-being within yourselves. The reality is mental functioning and wellness is a spectrum. And any given year, 20% of us experience mental illness, which is about 1 in 5 adults. This ranges from anxiety disorders like generalized anxiety disorder or social anxiety disorder to severe persistent mental illness like schizophrenia or bipolar disorder. In the middle of that spectrum is mental health. Oops. There we go. Which is about 65% of the population at any time. And this part of the population, they're doing okay. Some people are here naturally by way of your genetics, but some people really have to work at just this portion. In this spot, it can be relatively easy to feed the negative thoughts and behavioral patterns that may evoke sadness, worry, or anxiety, meaning that they can go unchecked and it may progress into mental illness. And then the third category of psychological functioning is mental fitness. In this category, people are flourishing, demonstrating equanimity. They demonstrate psychological composure that's minimally disturbed by exposure to strong emotions, pain, or challenges. And the reality is we all experience emotional injuries regularly. Things like failure, a breakup, rejection, being passed over for a promotion. You get the idea. Life is hard and things happen to all of us. But mental fitness isn't the idea that we simply feel good all the time. And I'm not here to promote toxic positivity, but instead mental fitness is the idea that we can adapt positively to negative events, or simply we can get better at feeling bad. Mental fitness is something that you have to work for. Just like exercising the muscles in our body, we have to exercise our brain and our mind. The brain is a phenomenal organ. Neurons can adapt, change their function, and grow based on what we do. Our brain and our mind can be more strong, healthy, and fit, and ultimately can improve our performance and in turn, our physical health as well. But we have to be deliberate about it, and we have to do it before we encounter a crisis. There are 4 pillars of mental fitness to consider. The first is the emotional pillar. That includes things like self-acceptance, self-esteem, and resilience, and the ability to manage strong emotions when they happen. The second pillar is the social pillar, which is that of companionship and connectedness to others. The third is the financial pillar, which is that feeling of being in control of your finances, being able to handle financial setbacks when they happen, and being on track to achieve your financial and life goals. This is one we're not going to be able to fully explore today. And of course, it's important to know that there are a number of socioeconomic and political factors that can impact, often in an inequitable way, the financial pillar of mental fitness. Finally, we have the physical pillar. As we know, it's important that we engage in things like a healthy diet, regular exercise, and get enough sleep. But what happens when we flex our brain and mind regularly? We improve our mental strength and performance in a proactive and often preventative manner. Just like with our body, the more we practice, the stronger we become. This means we experience improvement in resiliency, self-esteem, productivity, concentration, confidence, energy, memory, and authenticity. And we improve our mental fitness, our physical well-being follows. Your brain produces a number of substances that can improve your physical health, like I've already spoken about, and down-regulate some of those things that cause problems, like inflammatory markers. The substances that can improve, make us better are things like endorphins that are natural painkillers, or gamma globulin, which strengthen that immune system. There are also reductions in risk of cardiac disease, stroke, and a number of other illnesses when we engage in activities that improve our mental fitness. But how do you cultivate mental fitness? What are techniques that each of us could be doing to improve our mental fitness day to day and thereby improve our resilience to stress and ultimately improve our physical health as well? The first one is breathe deeply, regularly. Regularly deep breathing for only 5 minutes a day can lower your blood pressure, reduce your risk of heart disease, and improve your memory. You can do this anywhere, like before a big board meeting or while sitting in your car in a traffic jam. Since you've been sitting here with me for about the last 20 minutes, let's take a moment and practice this one together. What I want you to do is breathe in slowly through your nose over a count of 5 seconds, feeling the air as it expands your chest, rib cage, and belly. And then exhale through your nose in a way that matches the speed and length of your inhale, feeling the belly draw in and your rib cage and chest fall slightly. All right, we're going to do this 2 more times. So I'm going to count to 5 as you inhale and 5 as you exhale, feeling the air as it moves through your nose. All right, inhale, 1, 2, 3, 4, 5, and exhale, 1, 2, 3, 4, 5. Okay, inhale again, 1, 2, 3, 4, 5, and exhale. 1, 2, 3, 4, 5. Great. Thanks for doing that with me. Remember, doing that only 5 minutes a day can improve your health overall. All right, the next thing, meditate. When we think of our mind as a gym, meditation is a basic mental workout. It trains your body to concentrate and can help us learn to pay attention to the things in our mind that may be unhelpful or troubling. It also helps us learn to tune out distractions. So sign off social media, put your phone down, and be present. Take 5 or 10 minutes each day and find a space free from distraction to be alone in your thoughts for those moments. Don't focus on what to do, what needs to be done, what's gone right, or what's gone wrong. Simply be present, acknowledging those thoughts as they arrive, but giving them no more energy. The practice of meditation actually will boost your mood and mental toughness, focus, and resilience. But physiologically, it also lowers your heart rate, blood pressure, breathing, oxygen consumption, adrenaline and cortisol levels, those stress hormones we talked about, and can reduce your risk of heart attack and stroke. Next, we have sleep. The development and maintenance of a regular sleep pattern is one of the most valuable things that you can do for your physical and mental health. Sleep is important for the formation of new memories, regulation of your metabolism and appetite, and the functioning of your immune system. Sleep is also when toxins are cleared from our brain. We know that people with insomnia are 4 times as likely to develop depression, and poor sleep is also associated with high blood pressure, type 2 diabetes, and obesity. If achieving regular sleep is challenging for you, I encourage you to pursue cognitive behavioral therapy for insomnia. These days, there are even apps on your phone that can guide you in this. And if you still have trouble, I recommend you speak with your primary care physician for a full assessment. All right, move your body, exercise, walk, move your body in any way you can. Not only is exercise good for your body, but it's good for your brain. A single workout can increase endorphins, dopamine, serotonin, and noradrenaline. These neurotransmitters help us feel good and help regulate our appetite, sleep, and our mood. And attention and focus also improve for 2 hours after a single workout. But there are also long-lasting effects of exercise as well, resulting from changes in the anatomy, physiology, and functioning of our brains. Exercise increases a variety of substances that play an integral role in our brain functioning, and one of these is brain-derived neurotrophic factor, or BDNF, which is responsible for protecting the neurons in your brain and helps them transmit messages back and forth more effectively. We also know that new brain cells are produced in our hippocampus, that memory part of our brain, meaning long-term memory can improve simply with doing exercise regularly. There's also changes in our prefrontal cortex, meaning that we have improvements in attention. And by making all of these brain changes, we know that there's a decreased risk or a delay in onset of degenerative brain diseases like Alzheimer's. But how much is enough? So people who incorporate regular physical activity in their routine are less likely to experience these mood and anxiety disorders and substance use disorders, but it doesn't require that you exercise for hours on end. Instead, 3 to 4 sessions a week of at least 30 minutes with aerobic activity can produce significant improvements and benefits. And even better, it doesn't have to be continuous exercise. So do things like take the stairs, park farther away, walk to the mailbox, simply move your body. Next is feeling the sunshine. Get outside daily if you can. Regular exposure to sunshine can improve your sleep, reduce your depression, increase vitamin D stores. It's anti-inflammatory and can reduce pain of arthritis and fibromyalgia. But my dermatology colleagues want me to make sure to remind you to wear sunscreen to protect your skin. All right, express gratitude. Appreciation is an art. Positive psychologist Barbara Friedrichsen said it best when she said, "The negative screams at you, but the positive only whispers." Negative emotions and events are constantly vying for our attention and frequently may affect us more deeply than positive emotions and experiences. Gratitude is simply being thankful for what we have, despite the things that we don't have or things that might be going wrong. But we can't really think of ourselves as grateful. Instead, we have to actively demonstrate gratitude to get benefit. There's an exercise that you can do nightly called 3 Good Things, which can increase your or decrease your burnout and depression, provide for a better work-life balance, and decrease your life and work conflict, which ultimately produces higher levels of happiness and can improve your sleep as well. So just before bed, ask yourself, what are 3 things that went well today, and what was my role in making them happen? For even more benefit, take an opportunity to write these down every day. But in the same vein, showing gratitude to others can also improve your happiness. Compliment others sincerely, give explicit thanks and praise, and consider writing gratitude letters. Writing a thoughtful, deliberate letter of gratitude can improve your happiness and for the subsequent 6 months. Additionally, the recipient may also feel appreciated and valued, and your relationship with them might improve. All right, this brings me to the last strategy to talk about today, improving your mental fitness: connection. Loneliness is the new smoking. Chronic loneliness increases early death risk by 14%, which is as significant a risk to your health as cigarette smoking is. Studies have demonstrated that more than 25% of us feel like we have no one we can share our personal problems with. It's important to cultivate and create meaningful relationships with others and participate actively in conversations, not just simply shooting a text message or engaging in social media. It's important that we find relationships wherein we feel we can share our feelings and experiences and feel understood and supported. By receiving and providing emotional support, we often can find a sense of belonging and self-worth. Studies have demonstrated that those who feel connected in their relationships with friends and family, as well as within their community, are happier than their less connected counterparts and find it easier to weather emotional storms that may come before them. It turns out there's also improvements in longevity in your immune system, and it can reduce your risk of heart disease. So to end, there's no health without mental health. People with serious poor mental health is a risk factor for chronic physical disease, and people with serious mental health conditions are at high risk of experiencing chronic physical problems. Similarly, people with chronic physical conditions are at high risk of developing poor mental health. And it's important that you take active steps to improve your mental fitness that can improve not only your mental well-being, but your physical well-being as well. All right, thanks for having me today. I want to thank you for your time and your energy. Please feel free to contact me on any of these social media platforms, and I want to just take a minute to open the floor to questions. All right, let's see. Hopefully someone out there is telling me what comes up in the chat box. So far, I don't see anything yet.
I don't see anything yet, Dr. Lindquist, but we're giving everybody a second here.
Perfect. I know it was a lot.
Yeah. So maybe I'll ask you a question.
Sure.
You talk a lot about, or you talked about the connection of people. Do you have what is your way of connecting with people that you love to connect?
Well, and I think the year has been hard for all of us with regard to at least like physically connecting in person with people. I think like many others out there, I do have sort of my bubble that I've stuck with, and taking an opportunity. I think creating a rule where you put your cell phone away is one of the best things I think that I can find in connection with other people. So when some of my girlfriends and I get together, we actually like all store our cell phones elsewhere from us when we're talking and hanging out with one another. But I think those interactions have been pretty limited this year. I definitely continue to engage in like Zoom conversations with some of my friends, which isn't quite the same as engaging with people one-on-one, but it certainly exists.
Awesome. Okay, we have questions.
I see them. Okay.
Now they're coming in hot and heavy. What is the best food for your gut health?
Good questions. The best foods for your gut health are going to be whole foods. And a plant-based diet overall are going to be the most important for your gut health. Limiting access to or limiting ingestion of processed foods and high nitrates. Perfect.
Somebody's asking about the title of the book you quoted from Dr. Oyster.
Oh, yeah. So that's an internal, it's the Principles and Practice of Internal Medicine. It's actually a textbook that he wrote a very, very long time ago that's used, that residents who are training to be physicians read when they're studying internal medicine.
Awesome. And Lori McCaffrey, our very dear friend from KeyBank, she's asking, she loves the quote, "There's no health without mental health." In your opinion, why is this not always a priority in our country?
It's a good question. I think individuals, particularly those with severe persistent mental illness like schizophrenia or bipolar disorder, I think there's a lot of stigma against experiencing mental health. So for a really, really long time, even people with just depression or anxiety didn't talk about their mental illness that they were experiencing in the same way that someone who has cancer might talk about their illness. And so likely a big piece of it is the fact that individuals with mental illness or mental health disparities have been stigmatized over a long period of time. And people who are doing well, who have mental illness, often aren't talking about it. And so it's hard to make it a priority when we're not seeing it in our families and our friends and people around us, despite the fact, again, that 20% of us nearly every year will experience some degree of mental illness. Also, like many things, the amount of financial investment that has to occur for addressing mental health and mental illness is often an investment on the front end, though we know time and time again, studies have demonstrated that when we invest in treating mental illness and make that a priority, that all those other things follow, right? We look at social capital, we look at employment, we look at physical health, they all get better. And ultimately we save money from a community perspective, but that initial investment can be challenging.
Absolutely. Okay. Amanda asks, Chinese medicine refers to meridians in our body. Do you see that in the mental physical mix?
I don't know that I follow that question. Amanda, can you unmute and ask it? Are we allowed to do that? So I make sure I understand.
Let me find Amanda. I think I found her. There we go. Hi, Amanda.
Is it life, like life forces? I want to make sure I understand. Amanda, can you tell me what you meant about meridians in our body? If not, maybe I can come back to Amanda because I want to make sure I answer her.
Amanda, maybe you can answer her in the chat box so we know so we can answer your question more thoroughly. And then Aubriana is asking, what are some suggestions in having conversations with a loved one who may not understand anxiety or depression? That's a huge one. That's a
real challenge. And I think the reality is a lot of my patients struggle to be able to express what anxiety or depression is, right? There's this sort of idea that people should just be able to pick themselves up by their bootstraps. And I think when I'm feeling a little spicy talking to people about it, I'll often say, but you can't pull yourself up by your bootstraps if you don't have any boots, which is often the experience in people with anxiety or depression. So I tend to talk about anxiety and depression. I know in this talk, we've sort of made this split between mental health and physical health, but I see all of these as just simply health. And so I often will talk with family members or loved ones about seeing mental illness, anxiety, depression in the same way that we think about cancers or heart attacks or stroke, because it is ultimately, we know there's neurobiology involved. It's just a really complicated process that often, because we haven't understood well scientifically, we've not done a good job of treating it like any other illness. Hopefully I've convinced some of you today that it is like any other illness, but sometimes I'll relate it to loved ones like cancer or like high blood pressure. We know that anxiety and depression are chronic diseases just like those that have the same or similar treatments, right? We have pharmacologic treatments or medicine-based treatments, but also therapies that work really well too. That's a hard one.
It definitely is. I think we all have that the feeling of sunshine is complicated in Alaska. You mentioned it, that we need to go outside at least once a day. Do you have any suggestions to get that sunshine benefit that we need, like improving sleep and anti-inflammatory?
Yeah. So oftentimes, while supplementing with vitamin D is not the exact same as getting sunshine, when we think about studies that have looked at seasonal depression, for example, which affects 10% of Alaskans, there is significant evidence that demonstrates that taking vitamin D, which is sort of like the sunshine vitamin, can help in some ways like the sun can. Similarly, individuals who experience seasonal depression may benefit from phototherapy or sad lamps or happy lights, lots of names by them, using them in the morning, which can help improve your sleep by regulating the sun. As the sun flows in your eyes, the pineal gland, which is a gland in your body, helps regulate a lot of different factors, but one of them is melatonin, which is a very important hormone in sleep. And we know that phototherapy or happy lights can produce that same change. And the melatonin can help with both sleep and some of those anti-inflammatory properties. But I think natural sunlight is always the ideal if you can get it, but it's hard here.
It is, and says it as the snow is coming down.
Yeah, as I see the clouds from my office.
Right. Well, I know we've got maybe about 2 more minutes. So if anybody else has any more questions for Dr. Lindquist, we'd love to answer them right now. If not, she does have this. We will be putting this presentation up online. So this presentation will be available. And thank you so much for joining us, Dr. Lindquist. Thank you everybody who's been here. We hope you got something out of it. We hope that you enjoyed this first ever breakout session for Go Red for Women. And we hope to see you at Go Red 2022 and throughout the year at other American Heart Association events. So have a great day and be safe on the roads if you're driving about.
Thank you for having me. I appreciate your time.
Thank you so much.